Good morning, everyone. My name is Maggie Titterington, and I'm president of the Chamber for Schertz-Cibolo, Selma area, Chamber of Commerce, and I'm very pleased to be joined this morning with CEO of Methodist Hospital Northeast, Michael Beaver, and I've asked him today to have a brief conversation with me to update all of y'all about COVID and the implications in our area and what's actually going on and any kind of really good advice he could have for us as we are going forward into the fall months. So with that, Michael, please fill us in on what's going on.
Thank you, Maggie. I appreciate the opportunity to visit with you today and share with the community a little bit about what we're seeing here in the hospital as well as across our region, and talk a little bit about kind of what that means to us and what we think is on the horizon. So I'll begin by saying, unfortunately, we are in the middle of yet another COVID surge. I thought, like many people, that we probably had our worst days behind us. We had, as you recall, a very significant surge last summer in June and July. And then we had one in January and February that exceeded the one from the summer. And with the introduction of vaccinations widely available for the community, we thought there might be another surge, but really didn't believe it would be significant compared to the previous ones that we've seen. Unfortunately, we didn't really anticipate the impact of a virus mutation like the Delta virus that's currently prevalent in San Antonio and across the United States. And it's having a very significant impact on our community, particularly for folks who are not yet vaccinated. So if you look at the previous surges and the rate of increase, the summer of 2020, we had a surge that escalated very, very quickly, went from 0 to 60 in almost no time. And when you look and compare that to the winter surge escalated far more slowly. And our belief is because by the winter time, we had all kind of mitigation factors in place. You know, we had experienced the first surge that was very unpleasant. And so at that point, everybody understood what socially distanced activities would be, understood how important masking was. A lot of businesses were still shut down. And so we saw that increase, although it got very high, happened far more slowly over time, which allowed the healthcare systems to be able to accommodate the patient volume a little bit better. Unfortunately, what we're seeing with this surge is that it looks like the first one. The spike is really going almost straight up. It's accelerating very, very quickly. And despite the fact that we have vaccines available, there are still a significant number of people in the community who haven't received vaccines for a variety of different reasons. And we are seeing the Delta variant spread very, very quickly among that community. So just to give you some statistics to give you kind of a sense for where we are, we have in Bexar County, we have 920 hospitalized patients today.
Wow.
And our peak from the winter was about 1,500. So we're only about 60% of the way there. But when you put that in perspective, we only had 150 hospitalized patients in Bexar County 2 or 3 weeks ago. And so that rate is going up very quickly, and it doesn't appear to be slowing down. So a few weeks ago, I would have told you I didn't think we would ever exceed our wintertime surge. And now I'm telling you, I'm pretty confident that we will exceed that surge.
Oh my gosh.
When we look at our projections of what we expect over the next several weeks, we don't think the surge is going to peak until the first week in September. So that's almost a full month of continued acceleration with the surge in our community. So we're expecting that number to be much higher than what we experienced the first time around. I can tell you at Methodist Hospital Northeast, at our peak, we had about 75 COVID patients, and today we have 67. So we're pretty close to that number already at my facility, and other hospitals across this community are in similar situation. A couple other statistics I will share. Nationally, 97% of the patients who are being hospitalized right now are unvaccinated. So the vast majority of the vaccinated population are enjoying the benefits of that vaccine. And although we are hearing from time to time about breakthrough infections, which do happen from time to time, the vast majority of those patients are suffering from flu-like symptoms, and they're not being admitted to the hospital. So in addition to 97% of the admitted patients being unvaccinated, 99.5 of the fatalities are from unvaccinated.
Wow.
So that's what's happening is the Delta variant is considered, you hear a bunch of different numbers. The conservative number is it's at least twice as contagious as the original COVID. And so you see it spreading very, very rapidly among the unvaccinated in the community. And it's compounded by the fact that we've largely gone back to living our old lives. I think we got the vaccine in a lot of our community and felt very comfortable that we could get back to normal living. And while that's been great, the unintended consequence of that is that we have a lot of people in the community who have not been vaccinated, who are also back to their complete normal routine and not socially distancing, not wearing masks, and finding themselves to be very, very vulnerable to this variant.
Wow, that is staggering, the numbers that you've just given us. I know that all of us are trying to keep up with it on the news, and a lot of us are unsure whether it's actually true numbers or whether it's sensationalization. And I think that doubt or that questioning is what is leading to a lot of people not doing the precautions that you've stated we should still be doing. So if you were to offer some suggestions for us to slow this down, or perhaps maybe peak sooner than the first week of September, because I know everybody's thinking about school. School starts
Right.
August 12th for our area. What would you give us as guidance?
Yeah, no, I appreciate the question. I'm going to touch on a few things that you mentioned. First is what people are hearing in the news, and I will say, we just had our senior leadership team meeting this morning. We were constantly trying to game plan, trying to stay one step ahead of this, and we talked about the juxtaposition in our community right now versus what we're seeing in the hospital. And while I would say the media at times is guilty of overhyping events, this is one we actually feel like is being underreported because most people in the community truly don't appreciate what's happening in their local hospitals. And so every hospital is at capacity. I heard a report today that there were no ICU beds available in Texas. I can't validate that, but that would not surprise me. And in addition to COVID, we still have other people in the community that have other ailments. We have, people dealing with cancer. We have people having heart attack, people having strokes. And so not only is this an issue with our COVID population, but it's really an issue with our ability to care for the entire community. So I appreciate the opportunity to talk to you today. And I hope people are paying attention to what's being reported on the media and that we can continue to get that information out. Second thing you just talked about was school starting. That, the timing of this surge is not good. I have 3 school-age children myself. And the thought of everybody going back to school at the same time with this continuing to ramp up, we're at a positivity rate in Bexar County of 19.9%. That's close to where it was at the very peak of our last surge. So it's very prevalent in our community. And remember, the vaccines have not yet been approved for children under 12 years old. So there's a lot of discussion right now about, what we can and can't do in schools, and if schools can mandate masks, and if they can't. And I'm going to leave that to the school administrators and the politicians to figure out. But it's very concerning to me that we are going to have a mass influx of kids going back to school at the same time this is happening if we don't have any of those mitigating factors in place.
Yes.
Then to the last part of your question of, what suggestions would I have? The first one I can't be any more clear about is get a vaccine if you haven't gotten a vaccine. The vaccines are showing themselves to be incredibly effective against COVID. I believe we will look back in hindsight and realize this was one of the most effective vaccines we have ever had, known to man. It has really, really worked very effectively. And again, the statistics I quoted earlier about the impact it's having on the unvaccinated community is tremendous. So the best tool we have in our toolbox to combat COVID and the Delta variant is simply vaccines. And it's not too late. I've actually heard some people say, well, the Delta variant's already here. Why bother getting vaccinated right now? And I would still encourage you, this surge is going to continue for several weeks. And so I would recommend getting a vaccine as quickly as you can. They're widely available across our community. CVS, Walgreens, HEB, a lot of other outlets are offering those, in many cases without appointments. Just show up and get them. So that would be number one, is go get a vaccine. If you've been hesitant for concern about the efficacy has been proven. If you're concerned about potential unknown consequences of getting the vaccine, we've had hundreds of millions of vaccinated people in the US and across the world, and seen really almost next to zero in terms of unintended consequences from those patients having side effects. So it's a very safe vaccine. So that's number one. Number two is, remember all the things that we did before when we had surges. Remember the masks that we wore, social distancing that we did, the thought that we went into about where we went, if we wanted to go into big crowds or didn't. I would encourage people to be thinking about it exactly the way we did before, even for people who have been vaccinated. The vast majority of the people, again, who are hospitalized are unvaccinated, but you can still get it and you can still conceivably transmit it even if you've been vaccinated. So I would just encourage the entire community to be thinking about this in terms of, this is a healthcare crisis for our community. It's one that I hope will subside over the course of the next month, but the next month is going to be pretty rough. And we just need everybody to really be kind of rowing in the same direction and trying to help mitigate the impact of this surge.
Wow. And I know here at the Chamber, we're going to be issuing out a memo to our members that going forward, just to be proactive as well, that we are going to ask people to wear their masks to our large gathering events where social distancing cannot be done, just because it's not a fear factor, it's a protection factor. And I think there are quite a few people that it's mixed. Their feelings about, well, I don't want to be told to do this, but in the essence of where we come in contact with over 520 member businesses in our area, and then they come in contact with their circle of people and so on and so on and so on, it's very sobering to think that one person that doesn't take just a little extra precaution could possibly take this to family members, to elderly loved ones, and it is quite sobering. And so I just really appreciate you being able to give us the numbers and the facts of what is going on, because as I said, we're not quite sure what to decipher through the news, and there is a lot of fear and there is a lot of uncertainty. And I do know that vaccinations are still being given. And so, yes, I received mine and my family, and I really am glad now that we did go forward and do that. And I did have reservations and hesitancy, but I got informed. I spoke to you. I did my homework. And so I would just encourage those that are listening to us this morning that you would go get your vaccinations, and that you would take the precautions of wearing a mask in public when you're going to be close to people, and keep sanitizing your hands. This is a protection factor, and we care about y'all, and it's just the right thing to do. So I didn't know if you had any closing remarks or anything else that you might want to add, Michael, that we haven't covered.
Yeah, Maggie, and I just appreciate the opportunity to visit about this and just create some awareness in our community about what really is happening. And that this is a healthcare crisis that we are in right now that I suspect will continue to get worse over the course of the next month. So I just encourage everybody to take care of themselves. Again, vaccines, the greatest tool that we have, but continuing to do those other things to help mitigate the spread will all be helpful. So thank you for everybody that's willing to join hands and help us make us through this.
All right, and we so appreciate y'all and our healthcare workers standing in the front line once again to try to get us through this crisis. Thank you all for joining us this morning. Thank you, Michael, for speaking to us and updating us. If you have any questions or any comments, please feel free to reach out to us at the Chamber. Or I would also encourage you to go online. I believe Methodist Hospital Northeast, they do have a website, and you probably do have a COVID update or an information site attached to that.
Yeah.
What is your website?
I would love to tell you, but I don't know off the top of my head.
Yeah, I wanted to just throw them off just a little bit. I will attach it actually to this posting on our Facebook so that you all have that website to get that information of COVID updates. But once again, thank you so much, Michael, for joining us this morning. Thank you all for joining us online and listening, and you all be safe out there and take care.